other concerns I have about trials regarding side effects. I mean, how do I know what kind of side effects I might experience on a trial and how to manage them, especially if something happens, at night or on the weekend, during off hours? I mean, who do I even contact? I have a primary care provider, I have my oncologist, I have the clinical trial coordinator. How do I figure out how to really best treat any side effects that I might experience?
That is a critical question, and if I answer this question in the context of phase one trials, as we discussed, safety and tolerability are two of the most important aspects that are being tested for a phase one trial. So one has to understand that because a novel agent is being tested, there is a chance that an individual may experience novel side effects because the drug has not been well explored in thousands of patients, as is the case in some big phase two or very large phase three trials. So this is very different from those phase two or phase three trials where the drugs have a known side effect profile. So in this situation, it becomes very important for a patient to keep an eye out for unusual side effects and symptoms. I usually tell my patients that, to have them be very proactive and let us know if they notice anything unusual after they start a novel agent or novel modality. This is very important for accurate documentation of which is what helps us to understand what may or may not be related to an investigational agent, because that is a primary objective. Now, with regards to the second part of your question of whom to contact, so whenever a patient enrolls on a clinical trial, they have a treatment team assigned and they are provided information with regards to who to contact when they have any questions that are related or unrelated to side effects. There's usually information about the clinical coordinator research nurse, there's information on the provider, and most of the times, as physicians, there's always somebody on call. So if you call the numbers provided on the information sheet that are provided to you, you will definitely, most definitely get a hold of somebody. In some cases, if you don't get a hold of somebody, then if you're experiencing a life-threatening emergency or side effect, then the best and the quickest thing is to call 911 so that you can go to an emergency room to be evaluated.